Hi, my name is Damien, and I'm going to be talking about lung cancer and its effects and significance in today's society. So first, let's start off with what lung cancer is. It's the uncontrolled growth of abnormal cells that start in one or both lungs. It's a very serious form of cancer, and it's extremely deadly if not treated. It doesn't have to start in the lungs, but it can travel to the lungs at one point to form tumors. They divide rapidly and stardom. These basically prevent our lungs from breathing properly or at all. Primary lung cancer starts in the lungs, while secondary lung cancer starts somewhere else and travels to the lungs. Both are extremely serious and deadly. History of lung cancer. To move on to the history of lung cancer, it was identified in 1761, as a disease or a cancer. Malignant lung tumors, which are the tumors that cause lung cancer, are only 1% of all cancers in 1878, which grows to over 14% in 1927. In 1929, a German physician, Fritz Lichtend, discovered the connection between smoking and lung cancer. In 1940, the lung cancer became the second deadliest cancer behind stomach cancer. In 1954, however, the American Cancer Society realized that the German physician was right, and they linked smoking with lung cancer. Lung cancer starts to grow rapidly in the 1990s and throughout the 2000s to where we are today. It was the leading cause of cancer deaths at 27% in 2013. Lung cancer is caused mostly by smoking, but can also be caused by secondhand smoke, genetics, asbestos, radon exposure, and even environmental factors. Now, these are basically the 5 causes of lung cancer as seen in the diagram. Lung cancer is a big topic in today's society, but not as big as it once was, which was a great thing. It's something that nobody wants to hear, but is still very prominent in our society today, and we should be looking for cures and better treatment because of all the people that smoke in today's world. In 2013, over 228,000 people had lung cancer. That's 14% of all cancer diagnoses. From 1984 to 2008, lung cancer is less likely for men. Instead of 102 in 100,000, there are only 72 in 100,000 cases. From 2004 to 2008, the death rates of lung cancer have also decreased. Men dropped over 10%, while women dropped 3.6%. It's truly remarkable that we are making breakthroughs in a very deadly disease, but we aren't finished yet. Lung cancer affects almost everyone in our class for a couple of reasons. Any of us students who are exposed to the causes like smoking may be at risk. Chances are we all know at least one person affected by lung cancer or people who smoke heavily, which is the leading cause for lung cancer. Lung cancer is extremely dangerous if not treated, so we should have all the awareness to know the symptoms and just what we're dealing with exactly. There are plenty of myths about lung cancer, and they are easily mistaken by a lot of people. One common myth is that only smokers get lung cancer. This is not true at all because it may be more common for smokers to get it, but there are plenty of other non-smokers who get lung cancer. Lung cancer is in fact curable even if it's not in the specific case, and most definitely is treatable if caught early. You are never too young to get lung cancer theoretically. Even though it's more common in older patients, it can happen to young adults and even teenagers. Quitting smoking would help a lung cancer patient tremendously. Chances are smokers' main causes of lung cancer are directly from smoking. So if they were to quit that, then they might have a better chance to fight the cancer or even prevent it if they have yet to get the malignant tumors. You are never too old to be treated for lung cancer, although it helps to be physically active and relatively healthy, at least besides the cancer itself. Now, to summarize the presentation, let's review. Lung cancer is the deadliest form of cancer even for women over breast cancer. There are 5 main causes of lung cancer, which the most common cause is smoking. Lung cancer doesn't have to start in the lungs, and it is basically a cancer where tumors develop inside the lungs and prevent breathing. Lung cancer has steadily been decreasing in cases and deaths over the past 20 years, but it is still the leading cause of death from a cancer. Lung cancer is very important to keep an eye on because it can be devastating. It's relevant because nearly everyone has known someone who smokes and or has lung cancer. Thank you for watching my presentation, and these are my sources.